AI is quietly transforming the therapeutic landscape, not by replacing therapists, but by supporting them in ways that make care more consistent, more accessible, and in some cases more effective. The hybrid model, where human clinicians remain central but AI tools handle structured tasks, has enormous potential when used thoughtfully. It allows therapy to extend beyond the 50-minute session, creating a continuous support system that connects what clients experience throughout the week with what they explore in therapy. When the model works well, it strengthens engagement, improves symptom monitoring, and increases the emotional safety net around the client. But like any powerful tool, it also carries risks that require strong boundaries, transparency, and clinical judgment. One of the most useful hybrid features is AI-assisted journaling. Many people struggle to reflect consistently on their emotions, either because they forget, avoid difficult feelings, or don't know how to articulate what they're going through. AI-guided prompts can encourage users to explore specific themes: stress, social interactions, sleep, conflict, or bodily sensations, in ways that feel manageable rather than overwhelming. The technology can help organize thoughts, highlight emotional patterns, or identify common triggers in a person's writing. For example, an AI system might notice that a user becomes anxious on certain days of the week or that negative thoughts consistently appear after late nights. These insights can then be brought to therapy, allowing the clinician to detect patterns far earlier than they would through weekly discussions alone. The positive side is clear. People learn to name their emotions more accurately, and therapists gain deeper context. But there is a warning embedded here as well. AI journaling can feel emotionally intimate, and without guidance, users may begin feeling more attached to the tool than to the therapeutic relationship itself. This is why clinicians must frame the journaling tool as a supplement, not a substitute, reinforcing that interpretation and healing still happen through human connection. Another powerful application is symptom tracking. AI tools can record sleep patterns, mood fluctuations, panic episodes, medication adherence, or physiological signals like heart rate variability. This data gives therapists a richer, more accurate view of the client's week instead of relying on memory, which is often incomplete or distorted by stress. For clients with conditions like anxiety disorders, depression, PTSD, or bipolar disorder, small fluctuations can be clinically meaningful, helping the therapist adjust treatment in real time. AI can also flag sharp changes, sudden mood drops, irregular sleep, or escalating rumination that might indicate increasing risk. These warnings are helpful, but they must be interpreted cautiously. AI cannot determine the cause of a spike in symptoms, nor can it differentiate between a stressful day, a personal conflict, or a genuine crisis. False alarms may cause unnecessary worry, while missed signals can create a false sense of safety. Human oversight is essential to interpret the data with nuance, ask clarifying questions, and understand the personal meaning behind the numbers. Appointment and routine management is another area where AI supports the therapeutic process. Many clients struggle with consistency, forgetting appointments, avoiding sessions during difficult emotional periods, or losing track of homework assignments. AI reminders can nudge people gently, keeping them engaged and accountable. These tools can send notifications about upcoming sessions, remind users to complete worksheets, or prompt them to apply coping strategies they practiced earlier in therapy. For example, someone dealing with panic symptoms might receive a reminder to practice grounding techniques at predictable times, reinforcing habits that support long-term stability. The advantage is that therapy becomes a more continuous process, not something that exists only inside the therapist's office. However, there is a potential downside if reminders become intrusive or emotionally overbearing. If AI pushes too hard, clients may feel monitored rather than supported, or become overly dependent on external prompts instead of learning internal coping strategies. Hybrid models become most effective when the therapist remains in control of interpretation and treatment direction. A clinician can use AI-generated insights to inform decisions, but they provide the emotional framing and moral reasoning that AI lacks. For example, a therapist might examine a client's AI-collected mood data and say, "I see your anxiety spikes mostly in the evenings. Let's explore what's happening during those hours." Or when an AI journal reveals recurring themes like perfectionism or family conflict, the therapist can guide deeper conversations that lead to long-term change. The data enhances therapy, but the meaning-making remains human. The warnings are real. AI can create illusions of understanding, encourage emotional dependency, or oversimplify complex psychological patterns. Without strong boundaries, clients may begin trusting the algorithm more than their own internal experience or more than their therapist. Ethical questions also emerge around privacy, data storage, and consent, especially if sensitive emotional content is collected by third-party platforms. Therapists must ensure clients understand what data is stored, who can access it, and how it will be used. Yet, when designed and supervised responsibly, the hybrid model offers more good than harm. It closes the gap between sessions, helps clients feel supported in real time, and builds emotional awareness in ways that accelerate healing. It gives therapists better tools to understand symptom patterns, adjust treatment plans, and respond early to potential risk. And most importantly, it reinforces therapy, not replacing the human relationship, but giving it a stronger foundation. The future of mental health care is not purely digital, it is collaborative. It brings together the precision and consistency of AI with the empathy, insight, and ethical wisdom of human therapists. This hybrid approach respects what technology can do while honoring what only humans can offer: connection, understanding, and the capacity to care in ways no algorithm can replicate.